And so I welcome you to this. And I want to, right off the bat, give credit to our Florida liaison, Norm Sherman, who just waved if you see him. Norm Sherman has been our retiree chapter liaison in Florida since we created the retiree chapter. And he came up with the idea because people were going to Florida before 65. He wanted to do a introduction to Medicare. So he put together the skeletons of the presentation when it was time for us to do it. Because again, it's like when you were working and we did pre-retirement workshops. 20 years ago, we could do an individual one-on-one. But when you got 100 people retiring and it takes half an hour to talk to somebody, that we just didn't have the resources to do it. So we did a workshop to get everybody. So now, we've got 100 people who signed up and said they wanted to attend. 100 them a half an hour or more, it also gets that. So Norm put this together. And then what I added was I've updated the figures as we go along, but I also put in the screenshots so that you can register for Medicare online, which now in the area of time of COVID is probably even more important. So first, I had to give Norm the credit for that. He's a great partner down there in Florida. And now all I got to do is figure out where the shared desktop is. Oh, share screen. Okay. There we go. Everybody see the screen?
Yes.
Yes.
Okay, fantastic. I'm supposed to be the techie, and now we are. So this is a good thing. So, like, it's the idea of this is just to answer questions, let you and take care of some of the apprehension of what happens now that you're mature. Around the welfare fund, we do not call people old. My predecessor, Erwin Shanis, was never old, which he reminded me repeatedly. One day, back when I didn't know any better, I referred to him as old, sitting in his office, and he said, "Doug, I'm not old, I'm mature." And then I looked him right in the eye and said, "Yes, you're very mature," and ran out of the office. So we're approaching maturity. This is a new stage of life. It's a new thing, and it's not scary, trust me. I've lived with it for 2 years now, and in many ways, it's a whole lot better. So this is just an introduction to what's the terminology, what are the different plans, what's it going to cost you, how is the city going to support you, and what does the welfare fund do to help you also. So to start with, Medicare has 4 parts. Okay, so the 2 that we're most familiar with are Part A and Part B. Part A generally covers hospitals, skilled nursing facilities like rehab centers, outpatient services, outpatient center charges. Part A you do not pay for. Assuming that you have paid into the Social Security system for 10 years, then Part A is free. If you had turned 65 while you were still working, you would have enrolled in Medicare Part A, and it wouldn't have cost you anything. So Medicare Part A covers hospitals, rehab facilities. Part B is the one you pay for, and that covers doctors, laboratory visits, physical therapists, those type of things. And so you have both of those, Part A and Part B. Part C, everybody says, what's Part C? Part C is called Medicare Advantage, and those are the ones that you see on TV and get in the mail. Medicare Advantage is the fancy name for an HMO, which means that if you take a Medicare Advantage plan, you have to use their network providers only. You have to be referred to a specialist. You have to have a referral for an expensive diagnostic test, such as an MRI or a CAT scan. Um, Depending upon the Medicare Advantage plan, there may not be coverage outside of where you normally live. I'm thinking of HIP in particular. HIP VIP is HIP's Medicare Advantage plan, and it's only good for you here in the city and surrounding areas. If you're in Florida, Arizona, wherever it may be, the HIP VIP doesn't serve you because you have to use their providers. Part D is the newest part, which is for prescription drugs. This is the one that gets everybody's crazed for some reason. If you have the optional benefits rider on your New York City health plan now, that will automatically become a Medicare Part D prescription drug plan when you turn 65. There's nothing to buy, nothing to do. And it just rolls over automatically. If you're in HIP HMO now, pre-Medicare, when you become 65, you have to file an application for the VIP. If you let us know, then we can get you the form and get it to HIP for you. So these are the 4 parts of Medicare. And like I said here, hospital Part A is hospital skilled nursing, some home health care, the hospice care, and that is at no cost. For the Part B, Medicare pays 80%, and then you in some way are responsible for the 20%. The city health plan you have now, GHI for most people, automatically becomes a Medicare Part D, a Medicare supplement. And the basic supplement is free of charge. So you've got your Medicare, you pay Part A, you've got the Part B that you're paying for, and then your supplement to pick up the other 20% comes to you if you're a GHI at no charge. And that Part B covers the outpatient services, the clinical labs, preventive services, and there is a premium. I've got a slide here later showing what the premiums are. In Part C and Part D, you must be in a drug plan when you turn 65. There is no if, ands, or buts. You can say, oh, I only take 1 pill for my blood pressure, or I only take one pill for cholesterol. Too bad. You still have to be in a prescription drug plan. You don't have to be in the one with your health plan, but you must be in a Part D plan. The general recommendation is give it a year or 2 with the plan associated with your, the drug plan associated with your health plan. And then if you find that it's too expensive one way or the other, we can help you find another plan. In the New York area, there's 28 other Part D drug plans available. But there are some tricks to doing that we'll talk about here in a second. So now comes the hard part. What do you pay? What's it cost me? Part A costs nothing. Part A is absolutely free as long as you've worked and paid into Social Security for what they call 40 units, which is actually, it used to be called 40 quarters, now it's 40 units, but it's actually 10 years. The Part B depends partially upon your income. So the standard amount that everybody's going to pay next year in 2021 is $148.50. This has increased over the years as the cost of medical care increases. If you receive Social Security at this time, the Medicare Part B premium will be taken out of your Social Security payment every month. If your income is above $88,000 as an individual or 176,000 as a couple, then you get hit by the famous IRMAA. IRMAA is not a girlfriend. My wife is jealous sometimes because I'm always talking about IRMAA. But IRMAA is the income-related Medicare adjustment amount. And what Social Security and Medicare do is they look at your tax return from 2 years before to see what your adjusted gross income was. And if it's above 88,000 as an individual, above 176,000 as a couple, then guess what? You're rich according to the government, and you have to pay more for Medicare Part B. And depending upon income, if your income's up to $750,000 a year, you're paying close to $500 a month for Medicare Part B. Don't worry, there's good news. The deductible. There's a deductible with Medicare every year at the beginning of the year. For 2021, it's going up to $203. What that means is you go to a doctor in January or at the beginning of when you're Medicare eligible in 2021, and the first $203 that Medicare would have paid, you're going to pay. After that, Medicare pays their 80%. If you're in GHI, there's another $50 deductible. So once you've satisfied the Medicare deductible, Medicare starts paying the next $50 that GHI would have paid, you pay. So your out-of-pocket cost for medical for 2021 is $253. Once you've met the deductible, there are no copays unless you're in a Medicare Advantage. If you're in the GHI plan, you got $253. After that, put your wallet in your pocket. When you go to the doctor, everything will be taken care of. For Part D, again, there's only an IRMAA amount. If you qualify for IRMAA for Medicare Part B, then Part D, there's also an IRMAA. The monthly premium for the optional benefits comes out of your pension, just like it does now. This year, that amount is $142.60. It looks like it's going to be up close to $150 a month per person for next year. But I won't know probably until tomorrow when we have our meeting with the city, monthly meeting with the city, and they talk about the rates. But that's what you can expect it to be. It'll come directly out of your pension check, just like it does now. It's just that instead of being $285, it'll be up to $300 if you're doing it for a couple. Okay. Let me see. I don't see any questions. Let me stop the share here for a minute, see if any questions pop up. Oh, I got questions. Okay. Let me see here. The question, yes, I'm going to post this on the website within a day or so when I figure out how to do that. I am recording the presentation so that you'll be able to watch it. If you want to record it yourself, go fine. Part A, yeah, there's limited coverage for home health aid within Medicare. They may do just for a week or two, and then the welfare fund benefit, which we can talk about, will fall in. Okay.
Can I ask you a question over the?
Okay, go ahead. Yeah.
Okay, so the IRMAA $500. Can you go over that again? Who's paying $500?
No, I'll get to that. I'm going to get to the IRMAA.
Okay, that's not my question. My question is, one of us is not on Medicare yet, so it's going to be like a split coverage, I guess.
Absolutely.
Right. And the main thing is, when I go to a doctor, I guess it's going to be a Florida doctor if I can find one. 80% Medicare. Does he get or she get the card, the GHI senior card? And they mail in for the 20%, or I have to lay out the 20%?
No, it'll all be done electronically. Don't pay them anything. Yeah,
So
because Medicare will send electronically to GHI the claims information, and then GHI will pay the doctor. And the recommendation is that when you're new, if you when you're first in and subject to the deductible, if the doctor says, oh, I want the deductible, say, wait until you get paid by Medicare. Because it's particularly at the beginning of the year, a lot of doctors will say, pay me your deductible. So they'll want that $200 up front, but then they may sit on the claim for 3 months. Next doctor you see, you figure you paid the deductible, the doctor says you owe me $200 because you didn't pay the deductible because the guy you gave the money to hasn't submitted the claim yet. So just wait and let, when you know that the claim's been processed by Medicare, then pay whichever doctor needs the deductible.
I have a
Once that 253 is met, it's a freebie all the way.
Yes.
Wow.
Now, kind of related to that,
Thank
not
you.
all doctors take GHI. I have doctors now that don't take GHI.
Right.
So will they take the 20%? Or is it-
Absolutely. Absolutely. If a doctor takes Medicare, GHI will pay them.
Okay, so even if I'm seeing a doctor now that does not take Medicare, that changes. if
No,
the doctor
yeah,
takes
that does not
Medicare.
take GHI.
Right,
If
the
the
doctor
doc-
doesn't take GHI now, so I pay the whole bill out of pocket.
Right.
But if they take Medicare, GHI will pick up the 20%.
Absolutely.
Okay.
Absolutely.
And the 142.60 that you said automatically comes out of my pension, that's for the Part D?
That's for your Part D plan, yes.
Okay, and one
That's
last
per
question.
person.
Right, maybe you'll cover it later. I'm not yet taking Social Security.
Okay,
So
we'll talk about
that's
that.
gonna come later, right?
Yep.
Okay. Thank you.
I have a question. If the doctor doesn't take Medicare or GHI, what happens? And then the other question is, how do I know if I'm on the drug plan? And if not, which drug plan should I use?
The first question was if the doctor doesn't take Medicare,
Or my GHI?
or, well, the main thing, when you're Medicare eligible, the Medicare participation is key. If the doctor doesn't take Medicare, then GHI will not pay. And if Medicare does not pay and GHI does not pay, in the vast majority of cases, there's nothing the welfare fund can do. It's just you've decided that that doctor is so good that you want to go to him or her and pay 100% of the cost.
So most doctors take Medicare, correct?
Most doctors do. What we find around here in Manhattan is the Upper East Side, Upper West Side. Sometimes they don't want to take Medicare. I talked to one of my doctors back in January, and he said they love Medicare patients because they get paid so much quicker, and they actually get paid more than some of the commercial insurance companies that they deal with.
And the other question is, for the drug plan, is if I have Express Scripts, do I have the drug plan? And
Yes.
I do?
Yes.
So then I don't have anything to do once I start Medicare with,
Nope, it'll automatically become the Part D plan.
oh, so I got it. Thank you.
Right, and if you've been using Express Scripts all along, that will automatically become a Medicare Part D drug plan for you.
Thank you.
If you've been using a spouse's drug plan, then check and make sure that will convert to a Part D drug plan.
I thought I had heard, but maybe I'm incorrect, that even though you're using Express Scripts, you cannot do the mail away. You have
No,
to go
it's
to
not,
pharmacy.
you can't, when you get to be Medicare eligible, you're not required to use mail away.
But can you use it?
Oh, absolutely, they'll love you to do it.
Okay.
And you can also, under Medicare regulations, get a 90-day supply, where
Right.
pre-Medicare, you could only get 60 unless you went to Walgreens for a special program.
Okay,
So
so
you
I
could-
can either use mail away
Yes,
or I can go to a local pharmacy for a maintenance drug. Right now, I have to do mail away if it's.
right, yes, you go to your local pharmacy, have it there. It might be a little more expensive, I don't know, but it's also maybe more convenient for you to pop down to the neighborhood drugstore
Okay.
rather than to wait for the mail.
Okay, but
Or
I-
if you're in an apartment where they have trouble sticking the envelopes in the mailbox.
Someone told me they couldn't do it by mail. Okay, got it.
Yeah, no, you can still do it by mail. What they can't, what a prescription plan can't do is mandate that you use the mail like they do pre-Medicare.
Got it.
which is for people who get frustrated with Express Scripts, that's good news.
Doug?
Yeah.
Hi. When we went in for the health form, it was already populated under the plan that we want. It said Emblem BCBS Senior Care. Is that the new name for GHI?
When you turn 65, yes.
Okay, so it's okay that that's it, right?
Yep, that's fine.
It says exactly that. I don't have to add GHI or anything.
No. If you're in GHI, when you turn 65, it automatically becomes the senior care plan.
And it's called Emblem BCBS Senior Care.
Right, Emblem is because it's Emblem. It's just like it was beforehand. You had GHI, which is a division of Emblem, providing the doctors and laboratories, and Blue Cross providing the hospital and rehabilitation, the skilled nursing facilities.
Okay. We're trying to, I tried to type that in, and for some reason, it wouldn't come. It just says to and then a name of somebody. You know what we're doing wrong?
Where are you at?
You're ahead. Go back one.
In the Zoom group chat.
Coins.
Oh, I don't know.
Yeah.
See what we have here for questions.
Okay.
Yesterday. Okay.
Spouse of a CSA retiree, husband's already on Medicare. You turned 65 in July. He wants the same coverage. Okay, so this person who turns 65, I guess, next July, all you have to do is apply for Medicare A and B. It will go through the screenshots for that. And then when you get a copy of the Medicare card, you send it to us. We give it to the city who gives it to GHI, and you're automatically enrolled in senior care and in the Part D drug plan. So, yeah, there's nothing really more to do. It just sort of happens automatically. Drug plan Part D is automatic, granted, yes. Okay, we're going to talk about IRMAA here in a little bit.
We know that you're not going to be doubling your money. So it's either Sprint or it's all.
Okay. Okay, so a question here, how does Medicare work if you're still working? So if you're still actively employed with a company of 20 or more employees and have coverage through that employer, that is primary coverage. And Medicare would be secondary. So if you are in that situation, all you need to apply for is Medicare Part A when you turn 65. And you've satisfied all the requirements. When you stop working, you then need to apply for Medicare Part B. There's a special form that the personnel office fills out to show when your coverage ends. You get that to Social Security, they put you into Medicare Part B with no penalty.
Doug, if you're working and you don't have health insurance from the company, you just apply for Medicare?
Absolutely.
And
Yes. If you don't have health care from an employer, then you and you don't have city coverage, then you would have to do that.
okay.
I have one more question. I was looking at page 6, which I think you had up there before. So IRMAA is related to Part B. I'm looking at Part D, and that's where I pay the $142, which might go up to $150. It says reimbursed $40 per month for each month in previous year. So that's in addition to IRMAA? That's a separate reimbursement?
Yeah, let me get you page 6.
Yes.
Is this the one? Yes.
Yes.
Okay. What this is the way the Medicare regulations were written, and the Part D regulations were written, and the way they're interpreted by the city and Emblem Health. We can't reimburse prescription copays for those in the GHI plan and the senior care drug plan. So we wanted to do something for those because that's 90% of our membership. So what we decided upon was $40 a month to help pay for the rider cost for one person in the family. So in February of 2021, we will send a check for up to $480 to everybody who was in the GHI drug plan for 2020.
So basically, that 142 that's coming out of my paycheck,
Will
It's
be
basically-
offset by $40, yes.
right, it's basically 102. That's great.
Yeah. And we do it for one person in the family because a number of our members have spouses in other welfare funds.
Right.
The other welfare funds provide benefits for their members. So if by chance you have a retired teacher with you, they get either $760 or $780 a year, ostensibly to help pay for the prescription plan. We don't do as much because we have a more extensive set of benefits than UFT does. We'd rather put the money into real life benefits rather than just, a blanket check.
But pre-Medicare, like I know you get reimbursed from the welfare fund like 90% after the
Right,
$100. So
right.
that doesn't happen once you're
No,
on
that doesn't happen when you're Medicare eligible, unfortunately.
it's separate. Okay.
You answered a question of mine about, because I'm on my husband's GHI and I'm still working. So what does Medicare do for me when I'm turning 65 in a few months? It's my secondary, but does it help me go to other doctors that are not in GHI?
If you're still working with a company of more than 20 employees,
Yeah.
they would just be secondary. So whatever the primary coverage would be, it's probably not worth paying the money for that unless you give up the employer health coverage.
Oh, okay. So,
But we can, drop me an email. We'll have a conversation because this is
oh, okay.
this is getting
Thanks.
very specific, and I don't want to
Okay.
disclose your secrets. Oh, you got a lot of good questions here. Okay. Spouses, retirees. Okay, how does it apply to spouses, retirees who are not city employees? Oh, how do you pay? Okay, if you're I'm having trouble understanding this question. It says, how does this apply to spouses of retirees who are not city employees and did not receive Social Security? So if you're a spouse and you're not a city employee, you're entitled to be covered by your spouse who's the city retiree. The city coverage is retirees and eligible dependents. So you can still be covered. If you're not receiving Social Security yet, which is smart, what Medicare will do is they will bill you on a monthly basis for the basic premium and for any IRMAA amount. So what you would need to do is save copies of those billing statements and proof of payment for the later city reimbursement that we'll talk about here in just a couple of minutes. So another one here, what's the fee if one member is a retired DOE teacher and the other is a retired CSA member? The fee is the same. In Medicare is a per person program. So it's the same amount. If you have a retired teacher and a retired CSA member, most likely you're going to qualify for the IRMAA. That will apply to both of you, and you can both file for the reimbursement for that amount that we'll talk about here in a little bit.
I wrote it down.
Okay, if you have Medicare and Social Security, but you're not 62, you would be eligible for IRMAA. You've got a Social Security disability. After you're on Social Security disability for 2 years, then they automatically put you in Medicare. So you need to contact us so we can let the city know about that, because they'll put you into the Medicare supplement like you should be, and will then make you eligible to receive any Medicare premium reimbursements.
some other people.
Let's see what we got here. Okay. Okay, somebody sees his emblem, you go to preferred providers, probably through the ABC group, Advanced Physicians Group, with no copay. You can still go to those doctors, and after the deductible is paid, then you'll have no copay with them either. Our new senior Medicare card, medical card says no Medicare Part B. Let me know because yeah, they may need a copy of the Medicare card, which I think we sent them, but just drop me an email and we'll take care of that. Okay. Okay, the prescription copay being 3 tiers. I've got a chart that will show you that in just a little bit. Spouse is paying for Medicare Part B. Yeah, probably taking both out. Durable medical equipment isn't in the drug plan. That's in the Medicare Part B. Going to the corner drugstore, that will work the same. You can go anywhere you want. Somebody's got GHI family plan. You're not going to lose that. If you turn 65 and spouse or partner and dependent children under age 26 are still on the plan, nothing happens to their coverage. They'll continue with the same coverage. You'll have Medicare, they'll have pre-Medicare, and they probably will bill the lower amount, but you'll still be covered by the Medicare and have the Medicare plan. The cost for Medicare Part B isn't reimbursed by the welfare fund, thankfully. That's reimbursed by the city, and I'm going to talk about that here in a little bit.
Rob, did I have another cup of coffee? I think my cup is over.
Okay, my wife is a CSA retiree who won't be 65 and is covered by her. You know, send me an email, John, and we'll figure that out. Yes, if you're covered by the GHI prescription plan, that automatically becomes a Part D plan. The $40 reimbursement is one person in the family who is Medicare eligible. Even if they're not city retirees, you're covering them, and so that's what we do. Medicare insurance card and tag.
Hey, Doug, could you ask people to mute themselves? It's a little hard to hear.
Yeah, if you can mute, guys, please. I haven't found that control yet. It's been a while since I did one of these. Okay, so the question here is about an out-of-network provider with GHI, and then GHI pays whatever that we supplement. When you're on Medicare, if the provider doesn't take Medicare, GHI is not going to pay anything. What we would do is we would take a look at the Medicare allowable charge for the procedure that you had. We would take 25% of that for our allowable charge and put it through our stop-loss benefit, which is a $1,000 deductible. So it has to be a very large, expensive procedure for us to give you anything back. And that was done by design because we don't have the resources to provide reimbursement for the doctors who don't want to be part of Medicare. You know, you get some of these doctors that think they're beyond Medicare, and where Medicare says the allowable charge is $5,000 for a procedure, they're going to charge you $30,000 and tell you how wonderful they are and that you need to pay them the $30,000. Well, if you want to do that, fine, we don't have the resources for everybody to go to these doctors. And when 90 whatever % of the doctors in the country accept Medicare. So that's how we do the reimbursement with that. My email address is dhathaway@csawf.org. We're going to talk about applying for Medicare here in a second.
Better nutrition are essential. That's why Eggland's Best gives you and your family.
Oh,
Do we
somebody's
have to
got
put in
name
at the end of the year, Doug, do we have to put in for these reimbursements? What at the end of the year do we have to submit to get reimbursed? Because I keep remembering when I took your workshops about 4 years in a row. What is it we have to send in? What is it we have to send in to get reimbursed? And the $480, is that automatically sent out?
Yeah, the $480 will come out, will be sent automatically. If you look at the rate charts for the senior care optional rider, there are 2 parts. One is the prescription plan, which this year is $142.50. The other is an extended hospital benefit, which costs $1 a month per person. We pay the $1 a month per person for you. So in order to, before we pay anybody anything, you know, the city will say, Doug, you owe us $22,000 for the November hospital benefit. And I'll say, prove it. So they send us a file with everybody that they're billing us for. And it has the code so we know what your benefits are. So we pick up the code and say, okay, Ava has the optional benefits rider. We're paying her hospital. Now we know we can pay her the $480. So it happens automatically with data we already get. And you don't have to apply for it or anything. The $480, or some fraction of that, will come automatically. Typically, it comes, you'll probably get it by the 3rd week of February. The first year we did this, which is now about 15 years ago, we had no idea how long it would take us to print 3,600 checks. So we said, well, let's date them Friday. So we went through, we prepared the file, we printed the checks, we stamped them, we scanned them for the document system, put them in the mail, and everything was in the mail. And we said, oh, guess what? It's Valentine's Day. So now it's referred to as the Valentine's Day check, because no matter what day of the week the 14th falls on, that's the day of the check. So the Valentine's Day check is now up to about 5,400 checks that we get in and out within a couple of days, and they'll come automatically in mid to late February. If by chance you don't get it, let us know. There can be a couple of reasons. One, the city forgot to update your health code, or 2, which is more concerning, is that along the way somewhere they didn't flag you as being a participant for CSA. We have the arrangement with the city to do it for our members. Other unions don't. So if you're flagged as a CSA retiree in the GHI senior plan, the city bills us the money. If they have you flagged as something else or not affiliated with any union, then you're not going to get the reimbursement. So we find that, we correct it, we go back to when we should have, and then we go there. So now let's talk about the Part B premiums and how you're going to get this money back. Hang on. So this is updated. When back about 2005, they put in the IRMAA when they were modernizing Medicare under Bush II. And they decided that to help relieve some of the pressure on the cost of Medicare and the federal financing, that those who were above a certain income would pay more for Medicare Part B. I normally only show the individual and the joint. There is a rate for married filing separately. Very few people I know do that, so I don't clutter up the slide, but I do have those numbers if you need them. What this says is, if your adjusted income on your 2019 tax return was $88,000 or less as an individual, or $176,000 or less as married filing jointly, then you do not owe any IRMAA. So all you're paying is $148.50. If you're in the next bracket, 88,001 to 111,000 as an individual, or 176,001 to 222,000 as a couple, you pay an extra $59.40. So it's $207.90 a month and all the way down. If you're over 750,000 as a couple, or over 500,000 as an individual, you're paying an extra $356.40 or 500. So now the question is, my God, that's a lot of money. But because you are retirees from the city of New York, anything you pay for you and an eligible dependent for Medicare Part B is reimbursed to you 100% by the city of New York. Okay? So if you have a spouse listing who is not a city retiree, spouse who's not a city retiree, make sure you keep your spouse healthy, because this is a lot of money that's coming back to you every year. The city does this in 2 reimbursements. As long as you filed a copy of your Medicare card with the city when you turn 65,
The other one should get it from her.
it'll come automatically to you, the standard amount, in the following April. So for everybody here who is now turning 65, you would get $148.50 in April 2022 for every month you were Medicare eligible in 2021. That'll come automatically. If you pay more, then you have to ask the city to give that money back to you. When you take Social Security, and we have a sample of the letter coming up, when you take Social Security in the fall before the year begins, it'll be coming out within a week or two, Social Security sends you a letter. It says, Doug Hathaway, this is what your Social Security benefit is for 2021, and this is what we're withholding from Medicare Part B. We're going to take $148.50 for the standard, or they're going to take $59.40 for the IRMAA. So we need a copy of that letter. So when you get those letters, save them. If you take Social Security, at the end of the year, you will get a 1099 from Social Security that will show you the amount of the benefit you had and what they took out for Medicare premiums. We'll need a copy of that. Plus, of course, knowing the city of New York, there's always an application. The application form, the letter, the 1099 for you and or the partner together. You submit them to us, we'll look at them, make sure you did it right, and then we'll send it on to the city. If you have a spouse who's already on Medicare, who turned 65 before 2017, they're going to get shorted by the city on the April reimbursement. But if they qualify for IRMAA, that'll come with the IRMAA. Somewhere in the Medicare regulations, those who turned 65 before January of 2017 pay less than everybody else for Medicare. So because maybe one person out of the 250,000 New York City retirees qualifies, that's what they give everybody. So they basically give people less money and then make you apply for it. It's called a differential. For 2019, it's an extra $318. If you qualify for IRMAA, it comes automatically when they process the IRMAA. If not, there's a special form and you can apply for that. For everybody now turning 65, there should be no problem with getting the standard amount. All we have to do is make sure we get them a copy of your Medicare card, which we do. We like to keep a copy because knowing the city and their tendency to misplace things or just ignore things, If you say, how come I didn't get my Part B? They'll say, we don't have your Medicare card. And then we can say, well, we send it to you on such and such a day. Here it is. And then a month or so later, you're going to get the reimbursement. So this reimbursement is not because the city likes us. It's because when Medicare was first established back in the mid-60s, the city saw that they could save an incredible amount of money on health care for retirees, which they're legally required to provide, as long, if they could get people in Medicare. So they went to the unions and said, we'd like to have all of your Medicare eligible retirees participate in Medicare. And the union leadership at the time said, fine, but you've got to reimburse to them what it costs them to be in Medicare. You're still saving a lot of money. And the city said yes. So for the last 20 years, it's been the full 100%. In the 90s, with various financial crises, they had a reduced percentage, but from about 2000, 2001 on, it's been 100%. And they stepped up and they did the IRMAA without anybody prodding them to. They realized that they had to do that. So this is something that is, a New York State thing. I believe the New York State retirees also get this, but you're not going to see this in other areas, in other states, at least not to this level. So if you qualify for IRMAA for Medicare Part B, guess what? As part of the Affordable Care Act, you get to pay extra for Medicare Part D as well. Same income limits. If you're in this first bracket of IRMAA, you pay an extra $12.30. If you're in the other one here, 222 to 276, you pay $31.80. Unfortunately, the city is not completely in the giving mood. They will not reimburse the IRMAA for Part D. When you see that the IRMAA for Part B can be $200 or $300 a month, and the most this is $77. It's easy for me to say it's not my money, but you can live with it. But the city will not reimburse Part D. But just so you know, this is there. When you see the Medicare statement where it says you're paying for Part D, you don't freak out and say, how come I'm paying for Part D with Medicare? Because I have the GHI plan. This is the IRMAA assessment that everybody has to pay. And what it does is it helps Medicare subsidize the Part D drug plans and keep the cost down on the rider cost for everybody. So you're helping basically to subsidize your own, healthcare premiums.
Why don't you sit down? Oh, yeah, they can see you.
Okay, so let me just stop the share here for a second, see if we got any more questions. Okay,
If with the pension, do you
They see you.
do you consider the entire amount as income for your pension?
I don't consider anything. This is what the IRS determines.
I know. So for these, for the fees for Medicare Part 2, Part B premiums, is your entire pension amount what they like?
I believe it is. I believe it would be. It's not subject to New York State, but it's part of your income. It's based on your adjusted gross income. So if you look on your tax return, whatever the adjusted gross income is, that's what they're going to be using.
Thank you.
Okay. Okay. Letter from Social Security to. Okay. Does the spouse of a CSA retiree send the card to us? Yes. Even if the member CSA retiree is not 65, send a copy of the Medicare card. There is a form that goes with it, because of course the city can't deal without forms. But actually, it's because a number of years ago, Social Security went from Medicare went from using your Social Security number as your Medicare number to some random combination of letters and numbers. And there's no way for the city to match up a random set of letters and numbers to your social security number. So the form basically does that. We have the form. If you're sending a card for a spouse, please let me know who the member is, so that we can do that and get that over to you.
I have another question. So many of us are paying a Part B premium and a Part D premium.
Yes.
If you're on Social Security, that automatically comes out of where?
If you're taking Social Security, the Part B and the IRMAA for Part D come out of your Social Security benefit.
Okay, if you're not on Social Security yet.
If you're not on Social Security, Medicare bills you on a monthly basis.
Okay,
So what we would need to get the money back from the city is a copy of that monthly billing statement and proof that you paid it. So, a copy of, an image of the check you wrote that comes back from the bank account. If you're putting it on a credit card so that you can get travel miles for when we can travel again. A page from whatever the page is that shows the CMS Medicare charge.
so basically you need 12 monthly statements and
12 monthly
proofs of
statements, right.
payment.
Just the page that has the Medicare, and make sure to use the current term, redact the account number. They don't need to know the account number. They just need to know that it's got your name and that you paid it. What I've done to get mine reimbursed by the fund is I'll take the monthly billing statement, I'll write the check, and I'll put the check on the bottom, and then make a copy. Because that way on one page, I've got the billing statement and I've got proof that I paid it.
Got it. That makes sense. Thank you.
So that way it cuts down. But if you are doing a credit card statement, then the one page, they don't need the whole statement, believe me. You send me more than I need, I'm going to shred it. When you send the Social Security letter, all we need is the first page. We don't need all the other verbiage of how to get it in 12 different languages or how they calculated it. The important information is on the first page. So just send, and always send copies. Never send me the originals, please, 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 please. Mail service into Lower Manhattan, as we've learned in the last 8 years, is abysmal. We'll go 3 days without mail, and then we'll get 4 bins 3 days in a row. This is before they were they thought people were sending us mail-in ballots. So please, make sure you have a copy, because sometimes I do misplace things. Sometimes I lose them in the mail. And if it was the original, trying to get copies from Medicare and Social Security sometimes can be, I wouldn't wish it on anybody.
Doug,
if you're taking, if your Medicare, Doug, if your Medicare is being taken out of your checking account, what's proof from Medicare? The CMS statement?
Well, we would need the billing statement and then the page from the bank account when you get the monthly statement. This shows they took out and it says CMS Medicare on it.
It's unbelievable.
Doug, can we take a photo and email you the receipts?
Everyone knows that George is close.
Huh?
Can we take a photo and email you the receipts?
Yeah, you can do that, but we only need them at the end of the year, so you would have to save them up somewhere.
Yes, so we don't have to necessarily mail them. We can email them.
Oh yeah, no, you can email it to me.
Thank you.
You can email it to me and I'll print it off and then scan it so that, What I will say is if you're gonna email me pictures of things, please don't do it over the holiday tablecloth. And please try to have the forms flat and be as much on top of it as you can. Because if the form is folded and you take a picture with your phone, you're going to get shadows. It's going to be gray and dark. And when I print it or pass it on to the city, they'll have trouble reading it. If there's any way to scan it or anything, that's even better. If you still have a fax machine, we can do that. And if we can't read it, we'll let you know. We'll try again.
Thank you.
His question here, Medicare bills quarterly, not monthly. The very first bill is a 3 or 4 month bill. After that, it will be monthly.
Just a quick question. I know you said this already, but I want to make sure I'm understanding. You said there's a form, when we send in to get reimbursed for the money we've paid, that there's a form that goes with that, you said, right?
Right.
I just want to make sure, you going to show us that form, or you showed it already?
I haven't showed you the form. What I do in January, or as soon as the city has the form available, I'll send a mass email out and I'll attach a link to the form on it so that everybody has it. We will also have it on our website. If you go to our website now, csawf.org, you can find the 17, 18, and 19 forms there. Because we leave them in case people want to go back. In January, February, when the 2020 form is available, we'll take a couple of the old ones off. And you can go back 3 years. So if you have a spouse who's Medicare eligible for a couple of years and you didn't understand this and you've been paying IRMAA, then we can go back for a couple of years and get it.
So we take that form and we send, like you just explained, all of those bills with proof that we paid it and send it to you and you'll forward it. And
yes, because I do that only for my own self-interest. Because what was happening was the standard Part B reimbursements will come in April. And then the IRMAA will now come in October. And long about the third weekend in October, I started getting a lot of irate retirees calling. And they were saying, how come you didn't send me my money? Well, first off, it's not my money to send you. And second, I have no idea what you submitted because you sent the forms into the city. For some reason, the idea of having a letter from one year and a 1099 form from another year confuses our retirees. And every time I do a retiree presentation and talk about this, I make fun of you. Because you are running schools with thousands of students or were responsible for millions of dollars in budget, and a letter from one year and a form from another throws you into a complete frenzy. So the idea is, if you're going to be filing for 2020, if you became Medicare eligible this year, you'll have a letter that says, Doug, this is what you're paying in 2020. And then they need the proof of payment. Going forward, once you're on Social Security and everything, in November of a year, that you get a letter saying, this is your Social Security benefit for next year, here's what the IRMAA is. So what we're getting now is a letter dated November 2020 that is going to say what Doug's paying for Medicare in 2021. I don't need that letter until 2022 when I'm filing for the 2021 IRMAA. And then I need the 2021 1099 that I get in January of 22. So the fact that the letter and the form come at different times tends to confuse some people.
so it's every January we should be sending all this to you.
Yeah,
right?
yeah.
Okay.
Once the form's available, and I will email the form out, what we do is we scan them, and in normal times, whatever those were or whenever those were, we would walk them to Labor Relations. Up until a year ago, August, they were in the same building with us. So it was very easy. You go down to the lobby, walk across and go up to the 3rd floor, and bingo, here you are. Last August, they moved over to Cortlandt Street, which is a 2 or 3 block away. We could still walk them over. Since the middle of March, they have been out of their office with no plans to return and no way to handle incoming mail. They still, if you had mailed something to the city of New York in mid-March, it's in the bin somewhere. They've had no way to handle incoming mail, as strange as that may be. So if it comes to, we figured that out very quickly. So if it comes to us, we can scan it, and I have arrangements to send them in bulk to the city, and then they can process them. So this is a way to ensure that the forms get to them. And they like it when we do this because we've done the initial editing for them. If by chance, when you file for the 2020 IRMAA, you give them the letter from November 20, and the form for 20, though that's wrong. They don't have the resources to submit that to, or to send that back, so it just goes in the bin somewhere. So that's why we want to take a look at it. And sorry about that. So, you know, we want to make sure that you get the money. It's a little more work for my staff and I, but we want to make sure that you get what you're entitled to as quickly as possible.
How do we make sure we're on your email list? Could you still
Yeah, the email is, it's in the chat here. It's dhathaway@csawf.org.
So we should email you to make sure we're on your list.
Yep.
Yeah, Doug, could you ask the 718-637 number to mute themselves?
Okay, whoever that is, please mute.
Thank you.
Thank you. Okay. So let's talk about the some of the changes that you're going to see. The slide that talked about tiers for your prescription drug plan, these are the tiers. So this is, a GHI calls the plan that you're in an enhanced Part D drug plan. The enhanced part is there is no deductible. Plain generic vanilla Part D plans have this year, or this coming year, have like a $445 deductible, which means the first $445 you would pay out of pocket, and then you'd start getting reimbursed or paying a copay. This is what the plan looks like for 2021. At the beginning, the first $4,130 in drug costs, you paid 25%, okay? The middle part here used to be the donut hole. Remember, you know, you may have heard people talk about the donut hole or the coverage gap. Initially, when the standard Medicare plan was created, they paid 25% here, you paid 100% here. So it truly was a donut hole. The city plan always had paid something. At one point, the plan paid 40%, then 50%. Now, under Medicare regulations, it's a flat 25%. But I keep this because this shows, you know, the various tiers. You'll see this in literature. You'll see the initial phase, you'll see the coverage gap. And once your out-of-pocket cost exceeds $6,550, then you drop down to paying 5%. And the plan and Medicare pay the 95%. Once you're at this point, once you physically have paid $65.50 out of your pocket, then the welfare fund can reimburse the next $5,000 worth of cost. No deductible, no copay. So if you're on very expensive medications, want to stay in this plan, budget on $6,500, and after that, we will pay everything else up to another $5,000.
That's Sears standard water heater?
Okay, so that's the drug plan.
Is that individual or for family?
That's individual. This is a per person. Everything with Medicare is per person.
I have a question. So I'm using an eye drop that's very expensive. When I get it from Express Scripts, it says it's $680, and I pay $50. So now I'm going to be paying 25% of $680,
right,
not $50.
yeah,
So it's
like
actually a lot
$150,
more money.
right.
Okay.
Right. What I'd suggest you do is work with it for a year, see what it is, because there are two parts to the optional rider. One is the drug plan. The other is the extended hospital benefit. Since we pay the hospital benefit for you, there's nothing that says you have to stay in the drug plan. You can go to a different drug plan. But I'd like to have people work at least 1 year to see what the costs truly turn out to be. So in October of next year, we can sit and see if there's a plan that makes more sense to keep those costs down.
What do they mean by true out-of-pocket about?
Well, that's what they call it. That's what it's called. It's called the true out-of-pocket amount.
plumber in your area.
That's what TROOP stands for.
That includes co-pays and all that?
This is just for the drugs. This is your drug cost.
Okay, thank you.
Actually, it's, you know, the way Medicare figures it, there is assistance from manufacturers of brand name drugs. So you may not pay the full amount out of pocket to get into this level with Medicare, but the way our guidelines are written in the fund, you do have to pay the $65.50. So, and you can, you know, if you're, put it this way, if you're diabetic and on a couple of injectable medications, you get to this level real quick. And then we can help pay for that. So if you think you might be at the point where we need to submit, you know, you need to submit to us, please save the monthly reports you're going to get from Express Scripts. They, instead of quarterly, they'll send monthly. And they don't do a very good job of continually updating what you pay. So we'd like to see the detail pages too. And then you can, once you get up to the close to the 65, excuse me, the 65.50, then we can come and look and see if we can help reimburse some of those costs.
That's automatically on.
Thank you.
You've got here the most recent welfare fund benefits. The big thing that's changed from what you have pre-Medicare, of course, is the reimbursement of the copays. We'll do that. We'll reimburse the $5,000 once you exceed the out-of-pocket amount, and you also get that $40 a month from the fund. So that's really the big change here. We haven't made any changes yet going forward, but we have the two pages here of what the benefits are.
This line is rigid.
The green one is what the welfare fund pays. That everybody who retired from as a CSA member, when you retired, you're entitled to everything in the green column. Those who have elected to remain part of the union and join the retiree chapter get the purple column as well, or pink, or whatever color it is. I have to pick different colors every year, so I know I'm looking at the right one. So these seem like different ones I hadn't used for a while. So these are all, the chapter benefits are all supplemental to the welfare fund. If you qualify and have a benefit from the welfare fund and the chapter is due to pay you something, that'll come automatically. You don't have to submit any paperwork. So now, the question everybody's asking, how you enroll? If you're already taking Social Security benefits, if you start taking them before turning 65, you'll get a Medicare card automatically in the mail about 3 months before you turn 65. And they'll say, here's your card. If you don't want it, let us know. If you're not yet taking Social Security, you're waiting till your full retirement age, which is 66 in a couple of months, then you have to apply for Medicare. When you do get the card showing the hospital benefit, the Part A and the Part B, make a photocopy and either email it or mail it to us. We'll do the cover sheet and we'll send it on to GHI, or onto the city rather. So how do you enroll? If you go to socialsecurity.gov or medicare.gov, it'll say sign up for Medicare. And these are the screenshots that you'll see when you go in to apply for Medicare online. Even more so now than when we first did this, it's important because Social Security offices are still closed. My wife and I had an appointment to do something with her benefits in March. We had an appointment for March 18th and they shut down completely on March 17th. And it took until October to get things straightened out over the phone. So you can do this online and there'll be no problem. So the first thing they want to know is if you're doing this for yourself. So what you did, you just check yes, you're doing it for yourself, click the next, and then they ask if you're blind, are visually impaired because there were additional things available for that. Then they want information about you, your name, your social security number, your date of birth. Are you blind? Have you been unable to work because of some other condition? You just answer those questions, click on next, then ask for contact information. What's your address? Do you actually live there? What's a phone number for you? An email address. They'll send you, as they process it along the way, they'll send emails. What's your language preference? How do you want somebody in speaking English to talk to you, or in reading English, whatever? You know, this is government stuff. What's the way you were born? If you're not born in the United States, they're going to want to see naturalization papers or citizenship papers. And then it says, do you want to apply for Medicare only, but not for monthly retirement cash benefits? If you're deferring Social Security until later, you want to say yes. This will only sign you up for Medicare, which is what I get pretty much everybody wants at this point. So you say yes to that. And you are enrolling under a different Social Security number or not. At this point, what they do is they say, write this number down, because this is a point, they've got the basic information on you. And if you can't finish the application now, you can come back with a re-entry number and pick up where you left off. So they give you some other disclaimers. Do you want to enroll? So they're enrolling you now in Part A. They're saying, do you want to enroll in Part B? And you want to say yes. And they're going to say, are you receiving Medicaid benefits? I'm going to guess that for pretty much everybody here, because of nice steady pensions, we're going to say no to that. So it's yes, you want Medicare Part B, no for whether you have Medicaid or other state assistance. You can leave them some remarks. And now here comes the trick question. And I put it this way because the way you answer this will either let things go through very smoothly or to completely put a wrench in the process, and it'll take months to straighten out. The question is, are you covered under a group health plan? The answer is no. The answer is no. If you say yes, you're covered under a group health plan, they're going to assume that that other coverage is primary and Medicare is secondary. However, since you're retired, your city coverage drops to becoming a Medicare supplement. So basically you'd have two supplements and no primary. What this question should say is something like, are you covered under a group health plan as an active employee? So if you're an active employee covered by a group of more than 20, Medicare is second. That's what they're trying to say, but but this question has caused people a number of problems over the years. And that's why I put it here and call it the trick question, and make sure that you understand that the answer to this is no. Fight your better instincts. Say no. And it'll make things a whole lot easier. So once you file the application and successfully do it, print the copies all along, you will get an incredible number of letters. It's like every time they turn around, they send you a letter. The first one will say, you know, we accepted your application. This is when it starts. Expect a Medicare card. So you get that, and that's within like a week or so of filing. Then later on, you'll get a letter saying this is what you're paying for Medicare. At some point, you'll get a letter that looks something like this that says you're going to pay IRMAA. It takes them a while to do it. The first bill you get from Medicare will probably be, as somebody said, for a quarter, for 3 or 4 months. only the standard amount. They then, in that 4 months, go back and do the calculations and figure out whether or not you qualify for IRMAA. So then they send you the IRMAA letter. And the IRMAA letter says, this is what you're going to pay extra. The next bill will show the IRMAA amount you should have paid for those 4 months plus the current month going forward. So here, this one was, this person had to pay $53.50. This is back from 2018, so it was a bit less. Then they tell you how everything about how it's going on. If you're not getting Social Security, this is the letter you want to save to file for IRMAA, because it shows what you're paying for the Part B IRMAA. You won't get a letter saying this is your Social Security benefit because you're not getting Social Security. So a letter like this. So save all the letters as you go along.
Doug, if your birthday is in April, how many months in advance can you apply for Social Security?
Okay, the enrollment period is 3 months before you turn 65, the month you turn 65, and 3 months after.
Thank you.
With no penalty. So the sooner you do it after January, the better off you are. Because that way you make sure that everything goes along. Generally, if your birthday falls during the month, it's the beginning of that month. So if it's April 15th, your Medicare eligibility is April 1st. If by chance you were born on April 1st, they'll probably start Medicare in March for some reason. I don't know why they can't start it on if your birthday's on the 1st of the month that month, but they generally will start it a month early in that case.
Doug, I have a
If your
question.
birthday's April 1st, you can apply January or February?
Yeah, you can apply in January.
Okay, thank you.
You can apply in January. And you have that 7-month period to file without penalty, meaning they won't penalize you. If you file after that, they can penalize you like a % a year for every year you're late filing. But it's not, if you're continuing to work, or if you have a spouse who's continuing to work after 65 and has benefits elsewhere, they can delay, and there's a form to go in and, get in without penalty later on. But I think everybody here's already retired, so we're good to go.
Does anything
Doug,
change
sorry.
when you apply for Social Security? So let's say I apply for Social Security 3 years after I start Medicare. Do I have to file anything?
No, just file for Social Security. When they see that you file for Social Security, they'll automatically take the Medicare premium out of it there. And then you'll get the 1099 to submit instead of the other.
Doug, regarding this IRMAA letter, is this the letter that you need a copy with the 1099 that we sent to you in January with the form?
Yeah, save anything that talks about IRMAA, save it.
Okay.
You go stuff out.
Thank you.
Okay.
You have.
Doug?
Let me stop this here. We've got some questions, I think.
Douglas?
Yes.
I just want to say on behalf of all of us today, you've been such a godsend to many members throughout the years, and how much we appreciate this, because, turning 65 is a milestone, but you've always been so good to answer our questions, whether it's this way or privately, and I'm sure we can continue to write with you as private matters develop moving forward. But thank you, Doug. It's really been helpful.
Okay.
Doug, I have a question for you.
Yeah, and you can all, unfortunately, everybody knows me by now, so I can't hide, so.
Okay, Doug.
This is what we do. While you are actively employed, I've been around CSA for 27 years. I've been employed for over 20 with the welfare fund. And it's always struck me how everybody was out taking care of everybody else, feeling like you're part of a family. There were times it was more of an us against them mentality, I think, but it sort of has permeated everything that I do and everything my staff and I do, is that we want to take care of you, and that you've earned what you've done in your working years entitles you to enjoy everything you worked for. And we just want to make sure you do it. And it's taking me a while to get used to the comfort of doing things this way. If you've been to if you went to a pre-retirement workshop or everything I forgot about my benefits since I retired, you'll know that I'll see somebody's expression and then I'll say, well, okay, what don't you understand? We'll go off on a whole complete tangent, but it will answer all the questions. And that's a bit more difficult to do this way. But the other beauty is that this is now available to people all over the country, where before it was only people that could come into our office or come to one of Norm's presentations down in Florida. So,
Doug, what's your email address again?
okay, it's D Hathaway
Yes.
at CSAWF for CSA Welfare Fund.org.
Right. You know my wife, Stacy Torres.
Oh yeah.
Yeah. Her and Al Zaychik are doing pension consults now.
Yeah,
She
yeah.
told me get on this call.
Good.
Doug, this is Ira Zaretsky. Can I talk?
Yeah, and like I'm going to be able to stop you.
Okay, so
And everybody who just chuckled knows you, Ira.
they know my wife, I believe.
Probably.
Sitting next to me. Okay, so there's an application for employment in Medicare Part B. It's called CMS 40B. And the whole thing is only your Medicare number. Do you wish to sign up for Part B? Your last name, your mailing address, city, your phone number, state, zip code, and a signature place and a date signed. And that's the whole thing. Now, is this the same thing as you just?
Yeah, it's the same thing.
So in other words, this can be done online also?
Yeah, it's the same thing as doing that form.
So is this a newer form than the one that you showed us?
No, what I did was when I applied a couple of years ago, I saved the screenshots. So, I can only go through and apply once. Up until applying for the Part A part is still the same. I did it with one of the employees in the union a year ago. But it still stays pretty much the same.
Okay, so
I would encourage doing it online, particularly now, because if you mail it, God knows where it's going to sit and for how long.
So that's my problem, Doug, because this one has a place for remarks underneath. It says 12 put down remarks. If what we need to do is, like Jackie's retirement day is February 1st,
right,
and we're still waiting for the TRS receipt to come to begin the whole process.
Right.
So I'm just wondering, how are we going to get back like a letter from them in time that we can go through with the rest of what we have to do? Because the first thing we need to send in is the special enrollment form.
Yeah, right. Yeah.
It's a bunch of stuff. So am I right to be concerned that we might not get the whole thing finished?
No, you'll be able to do it.
Yeah.
Yeah, it'll get worked out.
So under remarks, what would I write? Please send us confirmation ASAP.
Yeah.
And then just send it in online. So I would have to scan it in, correct?
Probably,
They're
yeah.
looking for a
Yeah,
signature.
we could talk offline too.
Okay.
Doug, I have a question.
Okay.
I'm getting widow's Social Security. Okay, I don't get my own. I get okay. On the form where it says Medicare information, it says, "Do you wish to apply for Medicare only, but not for but not for monthly retirement cash benefits at this time?" So I already get my husband's benefits. I just want to apply for Medicare. I don't want to get.
I don't think you'll have to apply. When do you turn 65?
That's me. August.
In August? You should get a card automatically, probably in May.
I should get a what?
You should get a Medicare card, enrollment card automatically.
In May.
Because they see that you're already receiving Social Security benefits. They don't care if it's widow benefits or yours.
Okay, thank you.
So they should send, and if by chance in May you don't get it, there's still time. Hopefully by then you'll be able to go into an office or talk to somebody on the phone who can provide specific guidance in that situation. But my understanding is that as long as you're receiving Social Security benefits somehow, about 3 months before you turn 65, you'll get the card automatically.
Doug, that's correct. I'm also a widow and I'm collecting my husband's Social Security, and I just received my Social Security, my Medicaid card in the mail.
Okay,
So
great.
I had the same question, and my birthday is the 31st of March, and it says Medicaid starts March 1st of 2021.
Great.
Thank you so much. And
Thank
another question, Doug, how do
Yep.
I know if I have, does everybody have high option rider for Part D?
If you, yes, most people do. If you get a prescription benefit through your health plan, then it'll automatically become a Part D drug plan. If you haven't had a prescription benefit, then you need to add one. And if you have questions, you can always email me and I can look up the code.
No, I have a prescription.
Okay. Yeah, it'll automatically become a Part D plan.
Okay.
Doug, I'm already a retired CSA member. So I have, like you've been discussing, I have Medicare as my primary and DHI is the secondary. Lately, I got things in the mail from Blue Cross Blue Shield telling me about other versions of the secondary. Are there other options we could use as a secondary other than GHI? And should we be considering switching? I'm wondering if you could advise on that.
You could be in any city-sponsored Medicare supplement. So you get the mailings from Aetna, you get the mailings from Blue Cross. But be aware that what they're proposing are primarily in what they call the Medicare Advantage plans that will restrict you in terms of which doctors you can go to. They'll want you to go to one of their doctors, and they'll have referrals on for specialists, and they'll have referrals on for expensive diagnostic tests, such as CAT scans, MRIs.
So they're not as good as GHI.
And so they'll restrict the network and put some restrictions on. If you stay with the GHI plan, then you can go to any doctor that accepts Medicare. They try to entice you with, oh, we'll give you a gym membership, or we'll give you dental benefits. Well, the dental benefits they give you are maybe 2 cleanings a year. You can get 4 with SIDS, and if you go to a SIDS participating dentist, it doesn't cost you anything. They'll say, oh, you can have a pair of glasses, but they'll give you $50. We give you 100, and the chapter gives you another 65. They'll give you transportation to the doctor. Well, the welfare fund is a $2,000 transportation benefit. So there's a lot of things filling in around the edges that we do, and it seems that the Medicare Advantages will put a few more restrictions on people than what they like. The main thing is, if you decide you're going to change, make sure that it says it's sponsored by the City of New York. Because the only way the Medicare Part B and the IRMAA get reimbursed is if you're in a New York City sponsored health plan.
Your answer already convinced me it doesn't, the best is not to switch because you ain't go to any doctor.
I like the flexibility.
I have a question. Sorry.
I understand people who've been in that, who've used a managed care plan forever. Like that, I've had them in the past. I haven't been particularly pleased, but the standard Medicare, just a small amount of deductible, and you're good to go. So,
I have a question that I think probably was answered already. So I go to an eye doctor who takes GHI. Now I'm on I pay a copay of $30. Now I'm on Medicare. I don't have to pay that copay of $30?
No. You won't pay, once you met your deductible, you won't pay the copay. You'll still pay the refraction.
It's basically over there, answer.
Once I've met the deductible.
Measuring for lenses.
Right, I forgot about the deductible. Okay.
I'm gonna go on.
Hey, Doug, I currently have a Medicare and GHI. My husband has TRICARE. TRICARE is basically used for my, I want to say my prescription that I can go on base and get that. I don't need anything else other than that.
No, no, you're good to go.
The Express Script. Okay, just wanted to know that. Thank
Yeah.
you so
Let's see if we got any more questions here. Somebody wants to apply for Social Security at age 62. Well, you can apply for Social Security anytime. So I guess if you're gonna be 62 in January, you could apply, next month for it or something. And you would be good to go.
Doug, what again is your deductible that has to be met in going to the doctor? And how do you know you've reached it?
Okay, well, once you're on Medicare, it's in 2021, it'll be a $203 deductible. And then there's a $50 GHI deductible. What you should do is just go to the doctor, and if they try to get a deductible, say no, let Medicare pay. And Medicare will tell you when you satisfy the deductible.
Oh,
You'll get an explanation of benefits from Medicare every couple of months, showing all the visits, showing what the charge was, what the approved charge was, what went to the deductible, and what they're paying, and what there'll be a column that says what you may be responsible for, and that's the amount that GHI will be taken care of.
awesome. Thank you.
Talking about deductibles, GHI is famous for, you go to the doctor, it's a $200 bill, they've allowed $39, and that's what comes off the deductible. So is it an out-of-pocket deductible, or is it what they call their customary charges, which are always ridiculous?
No, what it is everything is based on the Medicare allowable charge.
Okay.
So if the doctor charges $200, the allowable charge is $100. They're writing off the $100 that Medicare doesn't pay. So Medicare is going to say, okay, here's whatever the bill is, and it's based on that. It's not based on anything else.
Okay.
So when Medicare will report back after they pay what you may be billed, and that's the remaining part of the Medicare allowable. And the first $50 of that, GHI won't pay. After that, they'll pay everything.
Hey, Doug, in reference to the transportation and travel benefits, could you talk about that a little bit more? I've never heard of it. This is the first time I've ever heard of it. And would you give us some more insight in reference to that, please?
Sure. The welfare fund for years has had, I call it a transportation benefit. If the doctor certifies that you can't take public transportation to get back and forth from medical offices, then we'll reimburse 80% after $100 deductible of the charges you incur from like an ambulance service to get back and forth to a doctor's office. Also, if you're in if you're in the hospital and you're going to a rehabilitation facility, that's considered non-emergency ambulance, and no, Medicare doesn't pay, GHI doesn't pay, Blue Cross doesn't pay. We'll pick up 80% of that.
Okay, great. Thank you.
And that's an annual benefit. It's not a lifetime, it's an annual, and it's a per person. Everything welfare fund is per person.
Thank you.
As someone who hasn't retired yet, GHI stays my primary and Medicare becomes secondary? And is that the case?
If you're still employed,
yes,
then only take Medicare Part A.
Oh, I see. Okay. So in terms of my choosing doctors, does anything change? Do I still have to just use GHI doctors if I want to be covered?
No, you can use any doctor that accepts, once Medicare is your primary, you can use any doctor that accepts Medicare.
But as long as I'm working, it's not my primary, GHI is my.
Yeah, you would still have to use the GHI doctors.
Okay, so not much changes in terms of day-to-day doctors.
No, about when you're getting ready to retire, let me know. There are forms that need to be completed by your employer to show when your coverage ends, and so you can get into Part B with no penalty. We want to make sure you get that, and we can help you with that.
Thank you.
Excuse me, Doug.
Yes.
Yes, I'm the spouse of a CSA retiree, and I'm retired, but I have no other coverage. I only get coverage through my husband. I understand about applying for Medicare and that Medicare will bill me. How do I pay for the GHI senior care supplemental and for the drug premium, since I don't have a pension for it to be deducted from?
No, it'll come out of your spouse's pension.
It'll come out of my spouse's pension.
Yeah, just like it does
all right.
now.
Okay, great. Thank you.
Yep.
Doug, all the information has cited GHI. How is that applicable to Emblem members?
The HIP members?
Yes. Emblem HIP.
Yeah, okay. Well, the basic Medicare information about applying and all is the same.
Mm-hmm.
It's just that, really everything is. It's just that some of the specifics in terms of supplemental coverage are different. But you still need to apply for Medicare. If you are in HIP, you're going to need to apply for the VIP plan, which is their Medicare Advantage plan.
Mm-hmm.
So if you let me know, I can get the form to you and then we can get it back and send it to them.
Is the form the one that says HBP, New York City Office of Labor Relations? Is that the one?
No, there's a special Emblem Health form.
Okay.
And so just drop me an email. I have the form in the office on the server. I can get it wherever I am.
Okay.
And we can email it to you. You fill it out. That form is 4 pages, but you only have to put stuff in on 3, but they want all 4 pages back. Go figure. And Medicare Advantage plans have more involvement from the federal government. So that's why you need the special enrollment form.
Got it.
Then just flip over. It flips over, but you have to also apply, and Medicare has to see the form. If you ever decide to change plans, you have to file a disenrollment request. You can't just leave. So there's a few other things to deal with there. But in terms of the premiums and everything, it'll be the same. You'll use the same doctors you've been using with the HMO all along. It's just yeah.
Okay. Good. Thank you so much.
Yeah. And I'm sorry about that, but 90% of the people are in GHI, and I keep forgetting.
Mm-hmm.
Especially when I talk to retirees at this time of year, I figure they're all in Florida and they all have GHI. So.
Well, that would be me soon. But anyway, so let me see if I have this right, Doug. That we once a year, the end of the year, we just submit all the IRMAA papers and any prescriptions that are out of pocket, so to speak. Is that correct?
Yeah, if you exceed the out-of-pocket maximum limit, yes.
Right. The next question is, maybe I was hallucinating, I don't know, but do we get reimbursed for belonging to a fitness facility and go to a chiropractor?
A chiropractor should be covered by the basic health coverage and by Medicare. The fitness, the only plan that I know of in the city that includes gyms is the HIP VIP. And nobody else does that.
Okay.
The Empire plan may have silver sneakers, but the other plans don't.
Okay, thanks for this again. Thank you.
Okay.
It finally penetrated. Good.
Oh, good. Only one visit.
Doug, one more question. So
Sure.
basically, the parts you need are A, B, and D, because C is for those VIP programs.
Right.
Okay. So it's A, B, D, and we're good.
Right.
Okay, great. Got it.
Doug, my wife is a CSA retiree, and but she's not going to be Medicare eligible. We're moving to Texas. Not very many GHI doctors in Texas, but she's got coverage under my plan, my Blue Cross Blue Shield, and she should be good with that because that becomes my secondary. But she's still covered. I work for Verizon, so she's still covered. And when my question is there anything she needs to do to send to CSA, with anything that's got to do with my plan,
Only if we're going to reimburse prescriptions or anything, we want to know what the parameters were.
Right.
Now, is she covered? Are you covered on her plan as well?
Yes, I am.
Good. When you're both Medicare eligible, you need to pick which plan you want to be covered for Part D with.
Mm-hmm. Right.
because you can only be covered by one Part D plan.
Right.
And if Medicare, when they do their audits, find you in two, they'll drop you from one, and you could lose the basic coverage as well as the drug plan.
We both have express scripts for the long term. You know, my Verizon and what do you call it? You know,
Okay.
Verizon retiree and hers were both express scripts, so I
Okay.
don't think it's going to be a problem.
No, but when she becomes, does she have the optional benefits now or no?
She's what do you call it? She's retired, but she's not collecting anything. She's
Okay. Well, have her send me an email. We'll check the coverage, because you can, as long as you're in the Medicare, you can have all the Medicare supplemental health plans you want,
right.
but you can only have one drug plan.
Right.
What I'd like to see happen is both of you stay covered under her city coverage as a Medicare supplement,
Right.
but maybe be in your drug plan, okay?
Okay.
Because the only way to get the Part B reimbursement is to be in the city in the city health plan. The Medicare supplement with GHI costs nothing, even if you never use it.
Right.
And as a result, you can get several $1,000s back from the city because you're enrolled in the plan.
Okay.
And if she uses your drug plan, we can continue to reimburse the drug copays.
Yeah, she in Texas is a lot of GHI doctors, so but
Yeah,
there's
no, I
plenty
understand.
to cover under my plan.
Right.
Okay, I'm sure she'll be. It's Stacy.
I'm
She'll
sure.
be getting in contact with you later. Okay.
Right.
Thank you.
Doug, my situation is similar, but my wife doesn't have a separate policy. She's going to be covered under GHI. So what do we do in California where we don't have a lot of doctors?
Pre-Medicare or post-Medicare?
Pre.
Pre-Medicare, go to whatever doctor you want. If somebody said, you submit a charge for $300, they give you back $39. Well, that $261 counts towards our stop-loss benefit. And once you've accumulated the $1,000 of unreimbursed expenses, the welfare fund can start reimbursing your costs. So the most you'll have in out-of-pocket medical costs in California pre-Medicare is $1,250.
So what if a doctor charges you $400 and GHI pays $39 and we're already over the cap?
Well, then you send us a copy of that explanation of benefits, and the first $1,250 we reimburse at 80%. After that, we go to 100% of whatever the allowable charge is. In California, we don't subscribe. We don't have that many there. We'll use Midtown Manhattan as an allowable charge, so they'll be comparable. And maybe the doctor charges $400, but the 85th percentile is $350. So we'll base it on $350.
So what do we do with the difference? We just don't pay it?
You just eat that 50, but it's better than not getting anything back.
Okay.
Got a question here. I love this question. My spouse is a retired UFT member. Does IRMAA apply to UFT members too, or only CSA? I wish it was only CSA, but UFT is still part of the city, so it applies to everybody. But what I will do for you, and for anybody else that has a UFT spouse, since you'll each have your own health coverage in your own name, you'll each have to file your own IRMAA application. Send me your spouses along with yours. We'll make sure it's right, and we'll deliver it to the city for you. UFT, I do not believe provides that service. We will, and we're happy to do it to our brothers and sisters in the. No, we're more than happy to do it for our brothers and sisters in the UFT. Question here. 2019 retiree chapter supplement for home health aid is 20% of welfare fund. Does that equal $1,200 per year? No, that's $2,000 per year, and it currently would be $6,000 lifetime from there. The home health aid benefit currently for the welfare fund is $10,000 a year. with a 3-year or a $30,000 lifetime maximum. We periodically increase this so people have additional benefits available. The retiree chapter reimburses 20% of whatever the welfare fund pays. So the maximum welfare fund reimbursement currently is $10,000. 20% of that, even I can do that math, is another $2,000. So that it's $2,000 a year, and it would be up to currently $6,000 additional lifetime.
Hey, Doug, I don't mean to be funny, but I took really careful notes on every page, followed everything. You are amazingly clear, but I'm still confused. Do we just, this kind of becomes a little bit more understandable as we actually go through it? It's the deductible, what you can put in for, what you can't put in for. Should we just keep referring to this?
Yeah. Yeah, or you can always just drop me an email or give us a call and we'll answer any questions you have.
So is this the primary resource just to use?
Well, that 2-page chart, yeah.
No, this thing. I downloaded what you sent us all.
Oh, yeah, that's just that was the presentation today, and that'll get you through getting enrolled in Medicare. And then as things come along, we'll be sending emails out. You just got a letter describing the 2021 Medicare premiums. Save that somewhere safe where you know it's going to be in a year, and go find the one that talked about the 2020 benefits now. When the form's available, we'll send that out also as an email. And as you go through, it'll become second nature.
Yeah, I think the most thing that I guess I'll just have to work through is when we should put in for reimbursement. I think,
Yeah.
Okay.
If you have questions, just drop me an email.
This was fantastic. I really can't thank you enough.
Okay, I got a question here. I didn't mention this. Somebody mentioned that they got they have Emblem Health cards for Part B, and you also got a card with Empire Blue Cross for the hospital. And that's correct, because Empire, if you remember pre-Medicare, the GHI CBP plan, you used Blue Cross for the hospitals, and you used GHI for the doctors and laboratories. Once you're Medicare, it's the same thing. Empire Blue Cross provides the supplement for hospital, skilled nursing facilities, outpatient facility charges, and Emblem Health, GHI, provides a supplement for doctors and laboratories. So that's why you continue to get 2 cards. And you should also be getting, when you turn 65 in GHI, a 3rd card. This says prescriptions only, which is from his Express Scripts logo on it.
Oh, there's also another card if you need chemotherapy or injectables called the PICA card.
Yeah, the PICA card covers you until you turn 65. Once you turn 65, that's no longer applicable. Then you use whatever's in the Part D drug plan.
Okay, thank you. I didn't know that.
Yeah. Okay. See, you learned something new. It made it worthwhile. Okay, the IRMAA form is on our website. It depends on age. You have to be over 65 and paying for Medicare Part B to get IRMAA back. COVID cleaning fees. I like that one. COVID cleaning fees, I believe in the state of New York, they can't bill the insurance companies for. So if they charge them, you're on your own. Our dental plan wanted us to cover that for dentists. We said no. It's a cost of doing business. And a lot of the providers are using COVID cleaning fees, I think, as a way to recoup some of the income they lost while everybody was locked down in the spring. So we're not paying them. You can negotiate them. The dentist I normally go to, I think one will want like $25. I haven't been back for a while. Those are things that we're not going to be looking at.
Doug, I have a question. I think it's been on there, but I'm not sure if you answered it. How do you know if you're a member of the CSA retiree chapter?
Take a look at the pension statement you get every quarter.
Okay.
And down at the bottom, there'll be a deduction. It'll say CSA.
Okay.
And it's usually, I'm seeing who's talking, but I'm not going to make a judgment about how big your pension is. So, but you would see something there. If you're a member of the retiree chapter, it'll show a CSA deduction down below the health deductions.
Okay.
And if you're giving to the Political Action Fund, the COPE fund, there'll be a second deduction there.
That I know.
Or you can call the chapter and say, "Am I a member?"
Okay. And if you're not a member, can you join?
If you're not a member, you can still join. If it's been more than a year since you retired, then you'll have to wait 18 months to get the supplemental benefits.
Okay.
And we'll try to make sure that we don't pay you anything before then.
Yeah, I'm pretty, so far so good.
Good.
Thank you so much, Doug.
Okay. Let's see, what do we got here? Husbands in the nursing home. Yeah, you probably should get, well, the coverage you're getting is the city coverage, the Medicare supplements. So yeah, you would want to continue that.
Thank you, everyone. Happy 65th birthday. Signing off now for now.
Okay, if you turn 65 in 2021 with a letter about deductions from Social Security arrive. Once you apply for Medicare, after that, you'll start getting the letters from Social Security. And so, that's when you'll get the letters. You won't get it beforehand, because beforehand, they don't know about you. Once you initiate and say, I want to apply for Medicare and apply for Part B, then they'll start sending you'll be deluged by letters. Okay, so somebody says, what's the COPE fund? COPE fund is the Political Action Fund. The union can't use dues money to support politicians and things like that. So there's a separate fund called the COPE, or now they call it used to be, I think, Committee on Political Education. Now it's PAC, Political Action Committee. That's a voluntary thing. If you give $8 a month out of your check, you're part of the President's Club. They invite you to all the special events. And you get a wonderful jacket that's lined that you can wear at this time of year, embroidered. It says CSA logo, President's Club. For these 50-degree or 35-degree mornings to 50-degree afternoons, it's very nice for commuting, so it works well. The Medicare premiums for 2021, I think I mentioned them. They're in the materials. The standard amount for 2021 is $148.50 a month. I think that's about it.
Yeah. Just, Doug, if I can make a comment, I was actually able to do it while we were online on my other computer. They will ask you to create your own separate Social Security account when you go into it. They ask you to do that. So if you don't have it, they're going to want you to create an account. So
okay.
It's easy to do, and I was able to do it in 5 minutes, thanks to your help.
Right. It's good to have that, because one of the things you can get from that My SSA account is if you misplace the letter you get from Social Security, you can print a benefit verification letter. And what that will do is show whatever amount you're getting for Social Security. It will show the current amount that you're paying for Medicare Part B. And then at the bottom, it will show what you paid for Part B for the previous year. So if somebody was looking to apply in 21 for the 20 benefits, they could still get that by printing a benefit verification letter in 21. Also, if you sign up for the message center, then any letter that they send you will also be posted there and kept for like 6 months. So, so you know it's there. And I did this last year, so I know it's there. So,
Doug, may I ask you a question?
you may.
Thank you. Last year, the Medicare Part B refund, I did not receive it for my husband, and I contacted you. I even spoke to you on the phone, and you said it would be taken care of. I did never get it. I mean, obviously, COVID had a lot to do with it, but I never got last year's for him.
Okay, just I apologize for that, and
Not your fault.
you know, just drop me another email to remind me, and I'll go find the previous contributions, and we'll see what's going on.
Very good. Thank you.
Okay. Let's see. We have any other chats? There's a question about mental health care. Medicare. If it's a Medicare provider, they will pay some limited amount for mental health. If they won't pay and you let us know, we can pay up to $2,000 for mental health counseling. And if you need more than that, we'd have to put it through the catastrophic. So there are some resources available for mental health. What else? We got anything else? Okay, anybody else?
Hello.
Hello.
Hi, Doug. I just want to say thank you so much. It's very informative. I'll be waiting for my Social Security letter because I'm already collecting.
Okay.
So if I don't get it by January, the middle, then I should call them or something?
Yeah.
Okay.
When you turn 65.
In April.
Oh, yeah, you should get it probably sometime in January.
Okay, great. Very good. Thank you for everything. Very informative.
Good. I'm glad you found it to be a good use of your time.
Yeah. Thank you again. Take care.
York City, like Manhattan.
Doug?
Yeah.
We have a reservation that's
I made the
actually
mistake in doing
island
double
of Manhattan
security
called the Shinnecock
for Social Security to contact them. So now I can't get through it all because I can't remember my passwords. Any suggestions?
I think if you try to log in, I think you should be able to change your password.
But I did like a triple security.
Oh.
Although I think it would.
And I can't remember them. And I haven't been in since.
I would give them a call, you know, and I say this reluctantly because I know what you're going to be up for, but they may be able to have somebody on the phone that can help you with that or tell you where to call. I'm sure you're not the first one.
Okay.
But you know, I've got the two levels. I've got you know, the user ID, the password, and then either the email or the phone.
Thank you very much.
Hi, I'm enrolled on the two drug plan. How do I go about getting out from one drug plan? I'm with my husband. He works with Verizon. I'm with him. And now I want to keep my city. How do I go about shifting?
Look, you want to keep the city drug plan, or do you want to keep the?
I want to keep the city. I don't know why. What do you suggest?
What I would suggest is use his drug plan if he can cover you.
Okay.
And drop both of you from the optional benefits with the city. Drop the drug plan from the city.
How do I go doing that?
Yeah, if you send me an email, I'll send you the form.
Thank you.
Because this is the transfer period, and we can do it without pulling strings at all through the end of November. So just send me an email. I'll send you the form and with some guidance, and then you send it back to me, and I can get it over to the city. The reason, and there are two reasons to keep on his drug plan. One is if you're both on your city plan with no drug plan, you both get the Part B premiums reimbursed. which is a big deal. That's a minimum of probably, well, whatever 148.50 times 12 times 2 is. I haven't done the 2021 math yet. But that's a significant amount of money that if you drop the city plan completely, you're walking away from. And so if you stay in the city plan as a supplement, both of you, but use his drug plan, then we can reimburse the prescription copays at 80% for both of you.
Okay.
So you make out there too. And you're saving the maybe $300 a month out of the pension, plus you're getting reimbursed for the Part B, plus we're going to reimburse pretty much all of your prescription copays. So that would be the way to maximize it. Everything's perfectly legal. They're not going to come and lock you up in the middle of the night. It's perfectly legal, but it's just using the system to your advantage.
So he will remain on my medical, and
yes, he'll remain on your Medicare supplement. You'll be on his, and you'll be on his drug plan.
right. Thank you so much.
Okay. Anybody else?
Doug, I have a question. I just became Medicare eligible in December, and I'm not sure how I answered that trick question. What if I did answer it wrong? What should be my next steps?
You could probably call Medicare and find out how you answered the question.
Okay.
That might be the best thing.
Okay. The other thing, the form that you're going to send out, I already received the bill from Medicare.
Okay.
Do I wait for the form?
Yeah. How much was it for?
What is the name of that? I'm sorry?
How much did they bill you for?
For 3 months, for December, January, February, it was the 148.50 per month.
Oh, they did bill you that. Okay.
Yeah.
Well, yeah, we won't need you won't need the form until they show IRMAA, because they billed you just the standard amount for the 3 months.
So then when they send me the other bill.
Yeah, and you just save them up until the end of the year.
Okay, so do we send that like?
It reimburses at the end of the year.
Okay, okay. Thank you, Doug.
Okay.
Doug, can you please repeat your email address?
Sure, it's dhathaway@csawf.org.
Thank you.
Okay, anything else? Or is it lunchtime? Where I am, it's lunchtime.
Bon appetit. Thanks, Doug.
Okay.
Thank you, Doug. This is Nancy. See
Thank
you
you, Doug.
later. Nice
Thank
seeing
you.
you. It was
Thank
very
you, everyone.
helpful. It was good a review.
Thank you, Doug. Happy Thanksgiving,
Happy
everybody.
holidays.